Hi, today we will learn about endometrial cancer. Most often people confuse with say uterine cancer. Uterus has got different components, the inner layer, middle layer and outer layer, and the tip of the uterus is named as cervix. So cancer of the tip of the uterus is cervical cancer. The inner lining of the uterus is an endometrial cancer. The middle layer, which is known as myometrium, if there is a cancer of that, we say sarcomas. So totally there are different categories and treatment is different, the approach is different. So let us discuss about the endometrial cancer, which is nothing but the inner lining of the uterine cavity. About that we will discuss. Now, what are the causes? Why does this happen? Any female who is exposed to the estrogen hormone over a long-term period, how does this long-term period mean? Sometimes they may have early menarche and late menopause, so they have more number of periods, more years of periods, so they get exposed to this estrogen. Or they may take external estrogen, or sometimes there can be some tumors which produce the estrogen, or obesity. The fat in the body itself can produce an estrogen, so they are also at high risk. Rarely it can be genetic. We say 5% only, but there are some genes which are associated. So that is why nowadays we are doing this pole mutation, P53 mutation, and we are doing microsatellite instability mutations. All these we are doing, and these number associated with the Lynch syndrome, all this is 5% or less than 5%. Now, all these causes are not definitely related to this, but definitely they will increase the risk of having a endometrial cancer. The most important is high estrogen with less of progesterone.